Things that you've seen in real life do not always apply to your questions on your exam. This is one that happens really frequently. And the thing is, the people that you're taking care of in your clinical settings are super nuanced, okay? So you're not taking care of somebody who just has a high potassium level. You know, they've got COPD and CAD and respiratory failure and on and on and on. And you have to look just literally at what's in the question. You have seen nurses that will unhook an IV without flushing it, or will empty urine without measuring it, or what have you. But you're not always going to need to apply that to what is on here. What is the best practice? What is safe practice? So the exam is not going to, it's not going to focus on things that are super rare. It's not going to focus on tiny details. Now, during the course of your education, some of your tests really do get into some of the minute details of certain diseases. That's necessary at that point for you to understand and for you to get a grasp of whatever process or condition you're looking at. The actual licensure exam is not going to do that, okay? They're going to test things that everybody should know. They're going to test things that everybody should have heard of, okay? So, you know, when you read the strange case about the woman who came into the emergency room because her toe was just killing her and it ended up being a heart attack, that's not going to show up on the test, okay? You read in the news about these couple of folks that have gotten cured of AIDS, not going to show up on the test. You know, on the NCLEX, we are assuming people are not cured of AIDS, right? So those are the kinds of things that you want to make sure that you don't drag into your test questions. Who have I not called on?
JD.
No.
Were you saving a special one for me?
Maybe. All right, fine. JD. A nurse cares for an older adult client with end-stage renal failure. The client refuses to take medications prescribed for treatment. Which statements by the nurse are appropriate? So walk us through it.
So that would apply. You have to take these medications as prescribed. It's appropriate. Okay.
All right, so you have to take these medications as prescribed. True or false?
True.
Okay. These medications are helping you to get better. True or false?
True.
C, your daughter will be disappointed when she comes to visit.
I should probably say that.
Okay. D, you certainly have the right to refuse any medications.
True.
E, tell me why you don't want to take the medications.
Yeah, that's true, I think.
Okay.
I mean, I would ask that. I don't know about A, though. I'm going to say that you have to take these medications as prescribed because he can refuse them.
Yeah.
Yep. So that last answer kind of did clue you back in that the first one was probably iffy, right? Mm-hmm. Like you really, and you've heard people say, you've heard nurses say, you have to take these. Right. Your doctor prescribed them. Well, that's not true. Right. And unless you're dealing with somebody who's super confused, that's definitely not the route you want to go. And even then, that's a little squirrely.
Yeah.
These medications are helping you to get better.
I'm kind of on the fence with that one, too.
Okay. So
maybe help you feel better, not get better.
Yeah, he's not going to get better.
Yeah.
So what does that statement, these are helping you get better, kind of reek of?
I'm trying to hope.
False hope. Yeah, false hope. Coerce them into.
You're trying to coerce them into taking their medicines. Right. So, and yeah, it's kind of false hope. We might not be looking for something curative. They might not actually be helping them get better. It might be just keeping them from getting worse, which is similar to us, but not necessarily to them. And then they're put in a position where they feel like they have to argue with you about it. Well, you know, then you're like, okay, so which medicine is making me feel better? And that's something you don't want to get started with somebody. That's gonna go straight downhill, and the rest of your day is going to be shot for both of you. Your daughter will be disappointed when she comes to visit.
Definitely not that one.
No. And you have heard people do this, and you just cannot play your patients that way. They have the right to refuse, and that's the end of it. So which ones are actually correct?
D and E.
D and E. D and E.